Hi everyone, this is Dr. Mike. Welcome to Health Talk by Dr. Mike. Tonight's episode is all about pain in your throat. Have you experienced having this difficulty or some pain or soreness on your throat? Our episode tonight is all about sore throat, and I guess some of us have experienced this, or most of us have experienced this medical condition. So, without any further ado, we'll discuss this topic, symptoms, treatment, and I would give you some suggestions as well on how to take care of this medical condition. Before we watch and proceed with our discussion, please do watch this. Once again, this is Dr. Mike. Welcome to my channel, Health Talk by Dr. Mike, here in YouTube and also in our Facebook page. But for tonight, allow me to thank first our viewers who have been our new members of our family, Health Talk by Dr. Mike, from all over the world, from our friends from different places. Thank you so much for following us, for subscribing on our Health Talk by Dr. Mike. So without any further ado, let's begin our discussion for tonight. Our topic is all about sore throat. As I have mentioned, some of you or some of us have experienced this, particularly during this holiday season. We've been attending different parties, different activities, and sometimes we use our voice often. And like, for example, in my case, I use my voice because I've been teaching several subjects, several courses, and I'm also doing a blog like this one discussing several issues, topics, and then I see some patients as well. So therefore, my voice sometimes I overused it. So allow me to discuss this medical condition, sore throat, including the causes, symptoms, and treatment. So I believe that some of you have experienced this. It's a painful, dry, or scratchy feeling in the throat. So sore throat is not anything but a pain, is a condition that we perceive, painful throat, dry, and pain in the throat is one of the most common symptoms, and it is associated for more than 13 million visits to doctor's office each year. I have seen several patients who have these problems. The medical condition is about pain on their throat. And then when we investigate further, then the condition pertains to this one. So I think this episode is for all the viewers who keep on asking, what is sore throat? How can we avoid this one? How can we prevent? What are the possible symptoms? Because sometimes it is a symptom of another medical condition. So these are the things that I would try to explain for you, dear viewers, tonight. Moving on, sore throat in terms of causes and the different factors, that most sore throats are caused by infections or by environmental factors like the following: dry air, particularly nowadays because it's winter in Hong Kong, particularly those viewers watching tonight, our friends watching from Hong Kong. The weather is dry, it's a bit cool, and although sore throat can be uncomfortable, it's usually go away on its own. So don't be scared that there's something wrong on your throat, because after a few days it would subside, the condition. So nothing to be worried about. In terms of the causes of sore throat, did you know that 90, ayan, you can see in our screen for the viewers watching, that viruses cause about 90% of sore throat, colds, the flu, and other viral infections. So it's very common, pretty much common. And the causative organism or the microorganism involved is the streptococcus, strep throat, and other bacterial infections. So these are the things related to the causes of sore throat. Aside from those mentioned uh, things that colds, flu, and other viral infections, the common cold, the influenza, the flu, and some of you might be asking, what other medical conditions or microorganisms present on the throat that may lead to this sore throat? So aside to the strep throat that I have mentioned, uh, or the influenza virus, also the mononucleosis. This is a kind of infectious disease that is transmitted through saliva. Measles can also have an illness that can cause rash and fever, and some patient may experience sore throat as well. Chickenpox. This is an infection that causes a fever and an itchy, bumpy rash. So patient may have also sore throat. This would be the possible causes. And mumps. So as I've mentioned, these viral infections, these are the possible causes of sore throat. So just imagine all those viruses that I have mentioned: chickenpox, measles, mononucleosis, streptococcus. Streptococcus is a bacteria. It's not a virus. So therefore, this would lead to certain degree causing sore throat. Okay. And also, some patient may have allergies. When the immune system would react to allergy, this would triggers the triggers like pollen, grass, pet dander, or animal dander. It releases certain chemicals that cause symptoms like nasal congestion, watery eyes, sneezing, and throat irritation. The excess mucus in the nose can drip down at the back of our throat, and this is called the post-nasal drip, and it can irritate our throat. So again, so viewers, we have this post-nasal drip, and then sometimes this would irritate, this would cause pain on our throat. Okay, and also the one that I have mentioned a while ago, the strep throat, the other bacterial infections, because it's not only viral that causes sore throat, also bacterial infections causing sore throat. And the most common here is streptococcus, the infection of the throat, and tonsils caused by streptococcus bacteria. Strep throat can cause nearly around 40% of sore throat in children, and tonsillitis and some sexually transmitted illnesses or infections like gonorrhea, chlamydia can also result into sore throat. So again, for the viewers watching, it's not only bacteria but also viral. So if you are having this viral infections, the one that I have mentioned, and if you also experience having bacterial infections, then it could lead to pain on your throat. Okay, sore throat. Another one I've mentioned about allergies: dry air. Particularly this season, dry air can suck moisture from the mouth and throat and leave them feeling dry and scratchy. The air is most likely dry in the winter months when the heater is running. So again, for those viewers watching who use heater every night or every day at home, this could dry again our throat. And then dryness of our throat, this might be one of the possible reason why we have sore throat. Okay, so remember that, viewers. Another one is because of exposure to smoke, chemicals, and other irritants, because there are different chemicals and other substances in the environment that could irritate the throat, which includes, this is very common, cigarette and tobacco smoke. For the viewers out there, smoking cigar or some tobacco, this might lead to sore throat as well. The air pollution, this might be a contributory factor as well. Cleaning products and other chemicals. So again, for our OFWs who use these cleaning products, strong odor, strong scent, this might irritate us, particular our throat, and it could lead to sore throat as well. So these are the things causing sore throat. Okay. So also injury. There are so many causes of sore throat. So the sixth one would be injury. Any injury, such as a hit or cut to the neck, can cause pain in the throat. Getting a piece of food stuck in your throat can also irritate it. Okay, particularly if you love to eat fish, the bony fish, and if this bones may lodge to your throat, it might lead to some effect as well. Okay, so remember that. And repeated use that you strain your vocal cords and muscles in your throat, you can get sore throat after yelling, talking loudly, singing for a long period of time. Sore throat are also a common complaint among fitness instructors and teachers who often have to yell. So again, for the viewers out there, I'm guilty about this one. Sometimes I feel pain on my throat because I've been teaching. I've been teaching in a university from Monday to Friday, and I talk to patients sometimes on a Saturday and Sunday, and I talk to you 3 times a week on our YouTube channel. So I need to rest my voice because if not, I may have sore throat. So I need to take care of my voice, similar to our viewers or for those kababayans, OFWs who are been teaching or physical instructors or leaders of our community who usually organize some events. So again, this might lead to sore throat. Another one is GERD, gastroesophageal reflux disease. I have a topic of GERD previously. You can watch that episode. For those people watching tonight who have had GERD or gastroesophageal reflux or acid reflux, please refer to my previous blog or episode regarding GERD because this might lead to sore throat as well, dear viewers. What is GERD? Is a condition in which the acid from the stomach, it backs up into the esophagus. So there's a reflux, the tube that carries food from the mouth to the stomach. So therefore, you might experience this heartburn or acid burns, the esophagus and throat, causing this heartburn, acid reflux, and regurgitation of the acid into your throat. So there would be backflow. Okay, so any gastric content, okay, if we have GERD because there's a problem on the esophageal junction sphincter, so it would back up, it would go up the food, the gastric content, and because the stomach is rich with gastric juices, okay, the pH is very low, it can go up and it can damage our gastroesophageal lining. Okay, for the viewers out there who have experienced GERD, please go and watch the previous episode regarding acid reflux or GERD. Okay, number 8, another one that may lead or cause sore throat is a tumor of the throat or vocal cords or voice box. Or tongue is less common cause of sore throat. Okay, when a sore throat is a sign of cancer, it doesn't go away after a few days. So if you are experiencing sore throat for a longest period of time, or a chronic sore throat, meaning you have sore throat for 3 months, 6 months, or even a year, you keep on having sore throat, please visit your physician so that your doctor would check your throat, visualize your throat. There might be some tumor on your throat so that we can check what kind of tumor, if it's a benign condition or if it is a malignant or cancerous condition. So these are the 8 causes of sore throat. So again, for the dear viewers watching tonight, at least you have the idea what causes sore throat. So if you are one of those individuals who have the following risk factors or the causes, try to avoid these things if you can avoid. Like, for example, if you are a teacher, so you should know what to do, okay? And if you have this gastroesophageal reflux, or if you do smoke, at least you need to eliminate this and modify your lifestyle so that you will not experience sore throat from time to time. Okay, so this one, what are the types of sore throat? So people might be wondering, people might be asking me as well. So there would be only, not only one types of sore throat. There are 3 types of sore throat based on the anatomical location of our throat. So we might be having pharyngitis, tonsillitis, laryngitis based on the anatomical structure or location of our esophagus or throat. Okay, so we have pharyngitis, tonsillitis, and I think most of our viewers would be asking me that sore throat are divided into three types based on the part of the throat they affect. Okay, so first one, it might affect your pharynx. If your pharynx would be affected, we call it pharyngitis. Pharynx is located, this is the area behind the mouth. Okay, so pharynx is the area behind the mouth. Let me have, I think I have a slide for this one. So this one, so as I have mentioned, sore throat are divided into three types, okay, based on the part or the anatomical part of the throat they affect. If it would affect the pharynx, which is located behind the mouth, this is called pharyngitis. Okay, that's the first one. The second one would be tonsillitis. If the sore throat affects the tonsils and the swelling and redness of the tonsil, which is the soft tissue part, at the back of the mouth, this is called tonsillitis. So you can see in the picture, okay, tonsillitis. So aside from pharyngitis, we have tonsillitis, and the third one would be laryngitis. If sore throat that you experience, there's swelling and redness of the voice box. If the voice box is affected or the larynx is affected, we call it laryngitis. So at least to the viewers now, you have at least an idea that if you have sore throat, some doctors would locate which part of your throat is being affected. If it is tonsillitis, if the tonsils are affected, tonsillitis. If the pharynx is affected, pharyngitis. And if the larynx or the voice box is affected, it's laryngitis. So at least nice idea for all of you. So tonsillitis, laryngitis, pharyngitis. So bottom line, it's all layman's term, sore throat. Okay. So the next one, what would be the symptoms? Most viewers would be asking, doctor, what would be the symptoms of sore throat? Okay, so I think some of our viewers are experiencing this now. I myself, because of the weather, and I keep on talking, not just in the vlog, but also in my class. So some of us may experience the following: scratchy, burning, raw, dry, tender, and irritated throat. It may hurt more when you swallow or talk. Your throat or tonsils might also look red. So therefore, when you go to your doctor, when you visit your clinics, the doctor would investigate further, check the oral cavity, check if the tonsils are red or swollen, and visualize properly. So again, you might experiencing the following symptoms. Okay. Sometimes white patches or areas of pus will form on the tonsil. Some doctors might see that, the white portion. These white patches are most common in bacterial infections such as strep throat than in sore throat caused by virus. So again, the doctor would try to differentiate if the origin or if the sore throat is caused by a bacteria or caused by a virus, because you could easily check if there's white patches around the area. Okay, if it is a virus, okay, so doctor would know. If it's a bacterial, doctor would know as well. So the white patches are common in strep throat than in sore throat caused by virus. So it's more the bacterial side. Okay. Along with the sore throat, you may also have symptoms as the following. Okay. No, as I have mentioned, when you swallow or when you talk, it feels that there's some uncomfortable sensation on your throat. So this might be not good. So you feel this pain on your throat. Okay, the other symptoms of sore throat, you may have the following as well. You may have nasal congestion, runny nose, sneezing. So you sneeze, sometimes you cough, and some would have fever. So elevated body temperature. Also, some, because of fever, some may have chills, swollen glands in the neck. Okay, so you might be palpating some lymph nodes on this area sometimes. Okay, some viewers watching, sometimes they are afraid when they palpate this area. Okay, oh, I have some cyst or some tumor. So don't worry because we have so many lymph nodes here. Okay, but again, uh, if you are sick, some of the time that the lymph nodes will be prominent this area, this would indicate that there might be some infection. But again, you need to visit your doctor so that the doctor can uh, advise to you properly and palpate this cervical lymph nodes. Okay, swollen glands in the neck. Sometimes you might be having hoarse voice or body aches. Some may have headache, trouble swallowing, and the appetite loss because of difficulty of swallowing. So these are the symptoms that a patient with sore throat may experience. And let me say something about treatment because this is the most important on how to get well after having sore throat or if we have sore throat. Aside from the 8 causes of sore throat that I have mentioned, these causes of sore throat range from infections to injuries. If you notice, this time, let me give you, aside from the symptoms, let me give you the home remedies. You can treat most sore throat at home. You don't need to get antibiotics or antiviral in the beginning. Get plenty of rest to give your immune system a chance to fight the infection. Okay? So, viewers out there, don't take any antibiotics right away or any antiviral medications. Okay? Again, the first thing to remember is this medical condition, sometimes it would heal on its own. Okay? If it's a simple sore throat. Okay? Usually within 2 to 6 or at least 1 week. Okay? So you don't need to be bothered about this. And as you can see in your slide, you can treat this at home. You don't need to buy medications right away. Get plenty of rest because your immune system can fight back this infection if you have a good immune system. So that's why I keep on advising our OFWs, particularly our OFWs in Hong Kong, and for those OFWs watching, part of our YouTube channel and also Facebook page, that take care of yourself, the diet, the food that you eat, and sometimes taking rest or having some exercise to have a strong immune system, boost your immune system. Okay, the first one that you need to remember, if you have sore throat, the remedy to relieve the pain of a sore throat, you need to gargle with a mixture of warm water and a half to 1 teaspoon of salt. So this might provide some remedy, okay, for those people having or experiencing some pain or having sore throat. So that's the first home remedy. Gargle with mixture of warm water and half to 1 teaspoon of salt water. I have done this, and some of our patients have done this, and it's effective. And so before taking medications, before buying medications, which are sometimes expensive, so you can take or use this one. So you can just go to your kitchen, get a warm water, and a teaspoon, half to 1 teaspoon of salt, and this might help you. Okay, that's the first one. The second one would be, this is common as well because this would provide a soothing effect. Drink warm liquids that feel soothing to the throat, such as having hot tea with honey, soup broth, or warm water with lemon. Herbal teas are especially soothing to the sore throat. So again, viewers, I've seen some patient yesterday when I went out, instead of taking soda or icy water because it's already cold, they've been taking this, and I heard uh, one of my friend that when I advised her to use this one, it really helps. Okay, so the viewers out there, you may try this one. Okay, drink warm liquids which should have a soothing effect on your throat, regardless if it's a hot tea with a honey, a soup broth, or warm water, or sometimes even plain warm water would be okay. Next one, this one is case to case basis, not for all. Some people are used to this one, cooling your throat by eating a cold treat like a popsicle or ice cream. So this might be suitable for those areas with summer condition or summer climate. Okay, so they may be having some ice, popsicle or ice cream. This would provide a soothing effect or cooling effect on their throat. But again, this one is case to case basis. But because not all would be comfortable having this one. But most singers, not most, or some singers, this would be the remedy if they are having problems with their voice. In my case, this is soothing for me as well. If I talk so much, if I discuss so much in my class, and if I do some blog, ice cream or some soothing effect, cooling effect on my throat, this would be an effective one. Okay. Next one would be place a piece of hard candy or lozenges onto your mouth, because lozenges might help this one because it has a soothing effect as well. Place a piece of candy and allow this hard candy to melt onto your mouth for a few minutes, and this might provide a soothing effect on your throat as well. Next one would be turn on a cool mist humidifier to add moisture to the air, or the last one would be rest your voice until your throat feels better. So again, so there are times you need to have vocal rest. The first one, cooling mist, humidifier, you might add that one so that the air would be moist, so that it would not be dry, it would not lead or cause sore throat. And the other one is resting your voice. So you need to have a vocal rest. Don't speak first for few hours or for specific days if you are resting your voice. So there are times that I myself, I do rest my voice. I don't talk, okay, for 1 day or for 2 days. So it depends. Or I minimize the I minimize my time to call my friends to discuss, so that at least I have I need to balance, and I need to manage my voice properly. Okay, similar with you, if you are a teacher, a professor, or if you are a singer, if you use your voice often. Okay, so these are the things that I could give you, the home remedies for sore throat. And remember, sore throats that are caused by viral infection usually get better on their own into 2 to 7 days. So I repeat that one. For the viewers watching tonight, the sore throat that are caused by viral infection usually get better on their own in 2 to 7 days. And some causes of sore throat that need to be treated, please go to your doctor. If you have potentially more serious symptoms like severe sore throat, if they are severe, you need to go to the doctor. Trouble in swallowing, trouble breathing or pain when you breathe, difficulty opening your mouth, sore, if you have sore joints, if you have a fever like 38 degrees centigrade, painful or stiff neck, earache, blood in your saliva or phlegm, a sore throat that lasts for more than a week. So if this would be the case, please visit your doctor. Because if it's viral, it would resolve on its own. If it is bacterial, it's a different case. Okay? So at least the standard period, it's at least 1 week, 2 to 7 days. Okay. So in summary, most sore throats get better on their own. As I have mentioned, bacterial infections like strep throat need to be treated with antibiotics. So that's the time for us, if it's bacterial in origin, to have antibiotics. See doctors for severe symptoms, the one that I have mentioned, trouble swallowing or breathing, a stiff neck, or a high fever. So don't wait so much time. Visit your doctor so that your doctor can help you. Most sore throats get better on their own within a few days. Bacterial infections sometimes need to be treated sometimes with strong antibiotics, okay, with a wide coverage. Antibiotics with a broad spectrum antibiotics. So that's the gold standard. But again, do not self-medicate right away because you don't know if it's bacterial or viral. So at least you have, that's why I mentioned a while ago, on its own, they would resolve, okay, 2 to 1 week. And if it's severe sore throat, severe pain, and then you have these other symptoms, then you might see a doctor. You need to go to your doctor so that your doctor would advise you, so that the doctor will check your throat for you and give you the proper medication for your sore throat or pain on your throat. Okay, I hope you learn again from this episode, and if you like this episode, you can share this episode to your friends, to your family members who experience having pain on their throat or sore throat, and at least I provided some home remedies for all of you. Okay, before taking some medications, because as I mentioned several times, it would resolve on its own. So once again, happy holidays to all of you, to all the viewers who are watching. And if you think that this episode is useful, please do like, share, and subscribe. And all the viewers from all over the world, from the Repiso family to all those people who are asking me to shout out them, I would create one episode to shout out all the viewers watching. Thank you so much for allowing me to share my knowledge to all of you. And again, I am based in Hong Kong. I've been in Hong Kong for 11 years now. And this is my way of helping our OFWs, our kababayan, not just in Hong Kong, but also our kababayan from all over the world. And I love to share my knowledge, and I love to share what I have learned, and para po sa inyong lahat. At para po at least maunawaan natin yung tungkol sa kalusugan natin. Hindi man tayo makapunta sa doktor paminsan-minsan, at least through our channel, I could give you some ideas on how to take care of ourselves. But again, you need to visit your physician because po, makikita po kayo nila, ma-examine po kayo nila, mapi-physical exam kayo, etc. etc. Mahirap po na hindi namin kayo nakikita. Like myself, hindi ko po kayo nakikita in person. So there are different diseases. Minsan po, madadiagnose natin ang isang sakit sa pamamagitan po ng tamang history. Tatanong ko po sa inyo kung anong nangyayari sa inyo, kailan pa nangyayari yan, pati physical exam, etc. etc. Kung may nararamdaman po kayo. Kasi po mahirap po magbigay kaagad-agad ng gamot without seeing the patient. Because alam po natin, there are some medications who have adverse effect. Baka po mag-allergy kayo doon o magkaroon pa kayo ng ibang sakit or contraindicated po siya sa mga gamot na ibang iniinom nyo. Okay? So once again, this is Dr. Mike. Maraming salamat po sa inyong lahat. Magkita-kita po tayo muli sa susunod nating episode. Have a great day, everyone. Merry Christmas and Happy New Year. Bye-bye.